Is there prevention for ankylosing spondylitis? Is there treatment for ankylosing spondylitis? That's the information contained in this video. Hello everyone, this is Dr. Jason West in the West Clinic, coming at you with 102 years of healings and 4 generations of doctors, and we're talking about the treatments and prevention of a specific type of arthritis called ankylosing spondylitis. So what are the treatments? Well, currently there's no known cure for ankylosing spondylitis. However, I think there's some really neat treatments that mitigate and improve the quality of life of people that are afflicted with ankylosing spondylitis. And other treatments such as chiropractic care, physical therapy, massage therapy, and acupuncture can help decrease symptoms and pain. And whenever possible, we'd like to avoid immunomodulator therapy, or what they call DMARDs, which stands for disease-modifying anti-rheumatic drugs, and TNF inhibitors. If we put the body back in balance, if we work on the GI system, your diet, your mind-body connection, there are a lot of positive possibilities with this condition. Now, diet is essential to avoid inflammatory foods. So things like refined white sugar, high fructose corn syrup, wheat, gluten, dairy, eggs, nuts, those are all factors. And the proof is in the pudding, and I urge people to do a food elimination diet. Let's get those inflammatory foods out of the system, and let's work on the ligament health. From a nutritional perspective, I think it's really important to do some blood chemistry analysis at the very baseline, a CBC with auto differentiation, so that you can determine what your white blood cell count. You can look at your monocytes and your eosinophils to see if they're increasing. We want to make sure that there's a healthy response from the immune system. It's kind of like Goldilocks and the 3 bears. We don't want it too high. We don't want it too low. We want it just right. You can look at inflammatory markers, and then the classic blood marker for ankylosing spondylitis is HLA-B127. It can be important in identifying and tracking the disease, but even more important than that, when we institute a treatment protocol, if we see improved quality of life, improved range of motion, we know that we're on the right track. There's also some specific nutritional tests, like a SpectraCell test, I think is really important, and getting the right building blocks into the system, including vitamin C, essential fatty acids, manganese supplementation. Manganese is the most important mineral for ligament health. Exercise is really important in managing ankylosing spondylitis. You don't want to stop moving. Small amounts of exercise throughout the day can be key to keeping the pain in control and making sure that the movements for your joints are appropriate. And posture is so critical. I say that and I immediately start to stand a little bit straighter, because practicing good posture can help individuals from becoming kyphotic or bent over and fused in a bent over position. Advanced therapies that I've seen really good clinical outcomes over the 20 years that I've been in practice, and it's not just me saying it. You can see testimonials on our blog, dailydosevitamin-h.com. Neural therapy, micronutrient IV therapy, where you're taking vitamin C, manganese, B vitamins, folic acid, are really significant in helping improve the quality of life of ankylosing spondylitis. I also think it's really important to rule in or rule out a chronic infection, whether it's mycoplasma, whether it's Lyme, whether it's Epstein-Barr or West Nile virus. I think that those microorganisms can set up shop in the ligaments. The immune system comes in to try and root out or control the infection. We get a chronic inflammatory response. The ligaments start to get scar tissue, and then they start to harden or turn into bone. And I think that's really important to upregulate or increase the immune system. And again, proof is in the pudding. I've seen really good outcomes with this approach. There's also some oxidative medicine and some things like ultraviolet blood irradiation therapy or UVLX therapy, which are really significant in creating wonderful patient outcomes. Now, moderate to severe cases, it may be a consideration to do something called dimethyl sulfur oxide therapy. And what that is it's essentially refined tree sap. It's a universal softener. It's really good for any sclerotic tissue. It does have the side effect that it makes you outgas or smell like you're having garlic or cream corn. There's kind of a sulfur type smell. It's been used a lot in the professional athlete realm and for racehorses. There's some really neat literature on DMSO therapy. So to summarize, ankylosing spondylitis may have a genetic origin. It can be exacerbated by environmental factors, including a poor diet, or if you're in a toxic environment around a lot of chemicals. And it's also really important to rule in, rule out infection. An improved immune system, movement, posture, mind-body healing, and advanced therapies like IV vitamin C therapy, neural therapy, which is a way to reset the nerves, and possibly the incorporation of dimethyl sulfur oxide therapy. This is Dr. Jason West in the West Clinic, and we'll see you on the next video.